Good evening. Welcome to another edition of Sound Health. I am Ola Sumbo Mudupe. We bring you Sound Health every Tuesday at 6:30 p.m. and we enlighten members of the public on trending health issues from around the world. What does it mean to be born with or acquire structural deformity? Is limb deformity treatable? And what is the cost of not seeking treatment early enough? Today, we are looking at what exactly is limb deformity and how to manage this condition. Stay tuned. The conversation begins after this break. The program is still Sound Health on Lagos Television. Dr. Charles Uzodinma, consultant orthopaedic and trauma surgeon with Cedar Crest Hospitals, Lagos, is going to tell us what exactly we need to know about limb deformities. He is also the Deputy Medical Director of Cedar Crest Hospitals. Good evening, Dr. Uzodinma, and thanks for joining us.
Good evening, man. Thanks for having me.
All right, Dr. Uzodinma, oftentimes we hear people say this person is physically challenged because of, as a result of polio and some other life-threatening diseases. How true is this? What exactly is limb deformities?
For those who are deformed with lower limb deformity, that is where it is. You have it either they are weak, the lower limbs are weak, not being able to carry the person well while he's walking or sitting or standing, or they are deformed. That is, the bones and the joints and the muscles are not standing in the other frame, on the other shape they would be. So either it is bending backwards so much, or is bent front, is unable to strengthen, or it is bending sideways on the right or the left. And these are different combinations of what one can have in in a situation like that, polio, which is just one of the conditions that can give weakness in the lower limbs.
Okay, so to a layman, what causes this condition? Is it a condition or disease?
The polio,
The limb deformity.
okay, if you come to limb, just like the polio is one of the causes of limb deformities. Polio is a disease that is caused by a virus. That is a virus that we often advocate that and say people should take vaccines as children to prevent. But apart from this deformity that is caused by polio, the lower limbs deformities are caused by the following conditions. One, there is one that is caused by somebody developed, that is abdominal shape or function the person developed while in the womb. So the person will be born with it. We say that one is congenital when the person is born with it, or the one someone then acquires. And then the one he acquires when he's already born, for one, there's one that is because the person is during growth, where the person is growing, when the child is growing, when there is an imbalance between the weight of the person and shape and the weight of the person and the ability of the bone to bear this weight that is coming. So the bone begins to bend in either to the side or to the or front or backwards. And apart from this one that can occur because of growth growth stage in the child, there are also the ones that can occur because and the person is also growing, the bones has disease that can also cause it. Either the bone has no, that is from malnutrition. You will hear a lot of times they mention the one that is when vitamin D from primary school. They usually tell us that for vitamins, especially vitamin D, once you don't have it enough, the bones are prone then going to be weak. So it will give rickets, and when somebody has rickets, the bones are weak. So they are bending to different ways. The body weight pushes them. And then, apart from that, the ones that are current this growth stage, there are ones that will occur due to injuries. Once, in fact, these are the ones that are caused due to injuries are the one that bothers us much, because all these ones were mentioned, somebody's somebody's nature, or the what person is has as inborn as his genetics line will last work on. But the one that comes from injury, it will get our heart bleeds in taking care of these children, because when in situations where the child has injury to the bone or injury to the joint or around the joint, if the correct treatment is not given, definitely it causes a deformity that some have become, some are easily reversible, some difficult to reverse, some as you reverse you have residual deformities while the person grows to adulthood. So these are a shade of these are main causes of the common ones that we have as abnormal limb shapes or deformities.
All right, thank you so much, Dr. Uzodinma, for that clarification. So, to look at diagnosis, now, how do you know that this person has this kind of condition? Is it treatable?
Okay, what usually happens is that once we see this, once we advise and tell everyone, when the child has deformities or abnormally shaped lower limbs, the one that layman calls legs. Once we have abnormally shaped legs, that is from the waist down to the feet, we advise and beg our parents and adult relatives, please take this. Once it's observed, even if though a day old, or 1 week or 1 month, or at 4 weeks, 4 years, please take this child to a center where you will see a qualified specialist, a qualified practitioner who will do the needful to assess. And what we usually do is, and the basic scientific approach we apply. I will first ask questions from the age. From what I've told you, there are some problems that are related to age of the child and so the growth stage the person has been on. And I also ask her when the problem started, is the person born with it or not? And, after asking that, we'll be able to check, begin to check that to see where is this abnormality coming from. Is it from the hip? Is it from the thigh? Is it from the knee? Is it from the between knee and the ankle? Is it from the ankle, or is it from the foot? Once we check this, we're able to say, even as we check this, from, by the way, when we're asking the question, we also find out from the time the results of and the time we are seeing the person, how has it progressed. And by the time we check even if they are equal on both sides, by asking questions and checking, we then go to do some checks. We do blood tests to assess some chemicals in the body that will tell us how far the person has what it takes to have good and good bone structure. Well, that's also when we can also test the chemicals that will let us know depend whether the person is malnourished, having nutritional deficiency like that, rickets and other. Then we'll do X-ray. Then, but it will show us this bone that is bending as we're looking at it from outside with the flesh. How is this bone looking like within the flesh, in deep where it is? By the time we do all this, a lot of times it gives it away. It gives us simplistic things that sometimes there are some that to treat is just to, as we say, go. Let's be observing with you. We'll say follow up with the client who will be coming monthly, 2 monthly to watch, especially the ones I say that there's a problem of imbalance in the weight and the weight of the child is building and the strengthening of the bone to bear the weight. That one we watch to see that there are some age timeline we expect it to correct out. And if it doesn't correct out, we can intervene and do either surgery or some manipulation to correct. Then there are some will now be that will begin if we see that is nutritional deficiency. For those tests, we have assessed some chemicals in the body. We give chemicals specifically to address those ones. There are some we say likely there are some disease of the bone that have made the bone to be bending or taking shape that is causing that deformity. There's one particular condition it forms in form of bowline. That when it's there, we call it Brown disease. It's just a name that comes after the person who found it, who made the first findings and the explanation on what is going on. And when we see that, there are ones we see and say, the time we see it, we begin to plan for any surgery that what we do is not surgery, because every surgery is significant surgery, but it's not a major surgery, but it's a significant surgery that we do, correct the angulation, and it also prepare the person's mind that this particular one, chances of doing more surgeries are there in future until the child finishes growing. And then there's what we usually try to emphasize for these parents. If we start early to do this surgery, the number of surgeries we do before the child finishes growth will be less. But if we delay, there's a delay and we start doing the surgery, the number of surgeries we will do will be more. Because what happens is that for every time there's that deformity of body, the problem that we want to correct will be getting worse. So these are a few of the interventions we do, but a lot of them are largely correctable. In fact, if not all, because most time when it cannot be corrected, it means that we have not seen the person or people who have what it takes to correct. For example, there are some in our practice system, there are children that we will see and treat. Permit me to inform you that in our hospital, because we are multi-locational, we have multi-location. And headquarters in Abuja. In that Abuja, we have a qualified, well-experienced, and at the same time, a gifted hand in treating this children deformity. That's even some that will appear indeed difficult for people like us or some other orthopedic surgeons to treat. When this man puts these children on the table, you see wonderful art. You see where God is working through the us as tools in maintaining and sustaining His creation. Sometimes too, some of us and myself and our other colleagues, a lot of times we'll go out of the drive to solve problems. We intervene in trying to work on these children. We make the situation worse. We come out the outcome that is very bad. This man again is well experienced and trained to and gifted to resolve the one that were also damaged again. So this is trying to emphasize and pass on the message that a lot of times these are treatable. Children should not be left to submit to only with due respect, either religious or feeling that is spiritually attacked or bad cause from lineage, and they're allowed to grow up with deformities that affect their ego as they grow up.
All right, Dr. Uzodinma, thank you so much for that clarification and assurance. Despite the myth and misconception, members of the public still patronize who we call the bone setters. As we wrap up now, what advice do you have for this category of the public and assurance to people living with this kind of deformities?
The bone setters do work that incidentally they are not trained to do, but they just do because they have the drive and motive to care. But the bones, the muscle, the flesh, how nature created them, they've never opened to study them. So it's a guesswork, it's a trial work. Sometimes, so a lot of times, some things that bone setter has worked and gotten results. There are also things that if somebody hasn't gone to hospital, it would have gotten better too. Because some of the things, remember I told you there are some situations where we say, let us observe and get results. So if the same person, that person going to one center and also doing whatever that hasn't been working, you will appear to get results. But I can say with authority that a lot times, if not all the times, the intervention of the bone setters, which is a blind intervention, does us the interventions do more harm than good. A lot of times in our practice system, we continue to treat complications that come from them because, and unfortunately, the way they practice, they give some fear or they give some guard that nobody goes back to them to say things have not worked. No, but because just like if you have not treated any patient easily, if he's not going to a council, he's going to court, he's going to places to complain. But nobody goes back to them. They feel that if you go back, a lot of things will happen. But where are the receiving end to tell you that the harm they do, honestly, it's so deep that if people should see number of harms they do and know how they do the harm and also understand that these things are done blindly, it makes a common sense, it makes a better sense to subscribe to somebody who has taken time and study, and you'll be able to ask me questions if I'm taking care of your child's deformity. To ask questions, I'll be able to explain bone, flesh, joints, how what they are doing and how they will be to be able to get what we desired outcome.
All right, Dr. Charles Uzodinma, in 30 seconds, your final words.
My final word is to say out there for all you any child, born and unborn, who is facing problem of abnormal or abnormally structured lower limb, or guardians who are facing this situation with their children. I tell you, you are not alone. There are so many, but it's solvable. Look out for qualified and the devoted and dedicated practitioners. If you don't look out for us, look out for anywhere you are. I assure you that you will not regret doing so. Thank you.
Look out for professional if you're experiencing limb deformities. Dr. Charles Uzodinma, consultant orthopedic and trauma surgeon, Deputy Medical Director, Cedar Crest Hospitals. Thank you so much for your expertise on how to manage limb deformities.
Thank you for having me. It's my pleasure sharing what we have to share. That's God, we got from God, free of charge.
You are most welcome. Sound Health continues with trending health report from around the world. Please stay tuned. is where we say thank you on today's episode of Sound Health. Whether you've been born with bow leg or K-leg, or you have acquired limb deformity along the line, please seek medical help early enough. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.